And welcome to A Date with Kiki. I'm super excited to be here as usual. As you know, my name is Bukola Kiki Jolugbo, and I'm the host of A Date with Kiki. I'm the founder of Joshua Zami and the Parenting Teen Boy Consultant. A Date with Kiki is a platform where we talk about everything men and boys. You know me, mention Kiki, talk about the love for men and the love for teenage boys. I can't help it. And that's why I want people to know a lot about men, a lot about teenage boys, so that we can live with them better and stop living with them based on assumptions. So you would forgive me. Well, in the last couple of episodes and the last one we had, because it's Mother's Day month, or the month is about women, I thought, what can we do to help our men understand us as well? Because I had some kind of funny episodes with my husband, I'm in my mid-40s, and, I began to notice some changes, and the man, poor man, he didn't understand what was happening. It's not as if I understood it very well as well. So we began to research and we began to think about, okay, what's happening? What are these changes that are happening in Kiki's body? And what can we do about it? And so that's made me to think, if my husband is having these questions, there probably are other men out there that are having the same question. And since I want to make life easy for men and boys, why not do this thing where I would bring experts in to come and talk about, some important areas of the life of a woman, educate our men so that they can know and be able to live with us in harmony. And it becomes a win-win situation. So the last episode, we talked about PMS, premenstrual syndromes. And today, we're going to be talking about another interesting one. Guess what it is? We're going to be talking about pregnancy. Yes, pre and post-pregnancy. I had some funny experiences pre-pregnancy, during pregnancy, and post-pregnancy. But that's so many years ago, because for my first child is 18 going 19, so many years ago, but I still remember them. And we're going to be talking about that with a very known doctor who deals with women's health. Our passion is on women's health. So my guest today is Dr. Kuku, Dr. Dayo Kuku, but we call her Dr. K of the Healing Zone. Dr. K is going to be talking to us about pregnancy, all the things surrounding pregnancy, pre, during, and post. Dr. Kuku is a GP practitioner here in the UK with decades of experience, and she's one that is so passionate about the woman's health. Dr. Kuku is a mother, so that means she's gone through everything pregnancy that we're going to be talking about, other than the fact that she's a professional. She's a widow. That means she was married, so she had those experiences with her husband as well. So I bet you would agree with me that there is no other person to talk about this thing with us today than Dr. Kuku Dayo. Why did I say? Because I'm used to calling you Dr. Kuku. So that's why I say Dr. Kuku Dayo, but Dr. Dayo Kuku. So please welcome with me our amazing Dr. K from the Healing Zone. Healing Zone. Hooray!
Thank you. Thank you very much, Kiki. I call you Kiki, and I'm going to call you Kiki today. Yeah, my name is Dr. Dayo Kuku, popularly known as Dr. K. Thank you for the opportunity. Thank you for the invite. Just like you said, I'm a GP, and I qualified over 30 years ago. So I've got more than 3 decades of experience. I'm a leader within the NHS, and I'm a keynote speaker. I'm passionate about health promotion and increasing health awareness. So I do a lot of education talks, health education talks. Also, I'm very passionate about women's health. And when you talk menopause, contraception, cervical health, and anything to do with a woman, I'm passionate about it. I'm also passionate about all things COVID. So I run regular talks on COVID, just to encourage people to make their decision based on scientific evidence rather than the misinformation and the myths out there on social media. So thank you for inviting me. And there we go.
Thank you very much, Dr. K. And I love the fact that you put in that COVID thing, because the other day I got on my family, I know this is this is a diversion, on our family WhatsApp. My younger sister sent in a video about COVID vaccine, and you needed to have seen the way I went boom. What do you mean? You don't send such thing? And everybody was like, Madam, take it easy. I said, no. Do you know how much and what our doctors are doing to educate us to? And they were just like, ooh, please take it easy. So, Dr. K, I'm representing you well. You've taught me well around that COVID thing.
Thank you very
We got to
much.
get educated and get these things done, so that we're not behind, and we don't lose out. We're losing a lot of people, and we don't want to keep mourning. But thank you, Ma. Thank you so much for doing that.
You're welcome.
So today, our focus is going to be on pregnancy, but I just want to say this so that I can I'll say this on this channel so that myself and our viewers can hold you accountable to this. That Dr. K, you have to come back and talk to us about pelvic health, our health around the womb and all of those things, the floor and all of those things. Deal?
We'll have a chat about that. I've got a better person for you. I've got someone who probably that's her specialty.
Okay, yes. Or I can bring both of you in. I think I know the
Okay.
person you're talking about. So we can come and do a
Yeah.
chat about it. But
Yeah.
we need to know about that area. But yeah,
No
let's
problem.
go on to today's topic. But
I'm yours.
all right. Before we dash in, please, if this is your first time in joining me on a date with Kiki, please, please, please kindly subscribe to the channel. Subscribe now and hit the notification button so that whenever we put up a new video, you can be notified so you don't miss out. But if you are a regular and you've been a subscriber on a date with Kiki, I love you. Thank you so much for coming back. And now let's do this. So Dr. K, my first question is, I know that, pregnancy comes in different phases. What are the different phases of pregnancy? And, if you could please touch a bit on the before, the during, all of those different phases, and what are the changes or the things that come with them?
Yeah, thank you. That's an important and good question. So with pregnancy, we talk about three main phases. The first phase is what we call the first trimester, and that's usually the first 13 weeks. The second phase is what we call the second trimester, which will be the mid from 13 to 26 weeks. And then the last phase is the third trimester, which will be from 27 weeks onwards to delivery. Anything above 37 weeks will be called term delivery. Anything below 37 weeks could be termed premature delivery. So if we go to the first trimester, the expected delivery date is actually used to calculate when you expect the baby. So the first day of your last period is actually when we start to calculate whether you're pregnant or not. So normally before we can say you're pregnant, we need to know what the days of your last period was, and that's where we calculate from. Usually in the first 1 to 4 weeks, you may not have symptoms, and you may also have a bit of cramping. A few people will have some spotting. And when I talk about spotting, people panic when you see blood. If you think you're pregnant and you see blood, then people do panic. But what I need to say about that is, if in the first 4 weeks you're spotting, there's some important bits to it. Most of the time it's due to hormonal imbalance. At that stage, you're probably not sure because it may be that you're actually expecting your period. So if you're spotting, what you need to do is to get in touch with your GP or your medical professional. The reason being, it could be nothing and it could be something. If you're spotting in the early phase of pregnancy and you have pain on one side of your tummy in your pelvis, then you must be sick. The reason being, it could be a sign of ectopic pregnancy, which is a pregnancy out or outside of the womb. So I just thought I'd mention that. The other things which you could have, so by week 4, that's week 4 after your last period, you would want to do a pregnancy test if you haven't seen your period. And that's when pregnancy then begins to count. If you people do their pregnancy test a bit early, and you might have inconclusive results. That's why if you do a pregnancy test that is inconclusive, it's recommended that you repeat it 2 weeks after, because by that time you'll be going into 6 weeks, and at 6 weeks you will get a positive result. So you've got the first few weeks, anytime from 4 weeks onwards, you could get a positive pregnancy test. And what you then will begin to feel is a few people will feel tired. A few people will have a bit of feeling sick, not actually vomiting, while some people will actually be vomiting. A few people will find out they're going to toilet more often than before. And some people might actually just feel they're bloated. Some people will have mood swings. You just notice you're edgy, you're touchy, and you're wondering what's going on. So these are the things that could happen in the first trimester. Some people also will suffer from heartburn. And if you suffer from heartburn, that's easy to manage. And that usually will come on around about week 6 most of the time. But if you're suffering from heartburn, then Gaviscon, which you can get over the counter, is usually a good remedy. Some other people will notice that they're gaining weight, and that's how they come to realize that they're actually pregnant. What is important is once you realize, ideally before you get pregnant, you should, if you're planning to get pregnant, then you should start folic acid, low dose folic acid, which is 400 microgram. You can buy it off the counter. And that's because it's been, evidence shows that it will reduce the risk of neural tube defects in the baby. So if you were not on folic acid and you realize you are pregnant, you got a positive pregnancy test, you should start folic acid immediately. And you need to continue that until you're around about 13 weeks. So that's the first trimester. Within the first trimester, it's also very important that you pay attention, and throughout pregnancy actually, but especially in the first trimester, you need to make sure, because that's when most of the very delicate organs are formed. So you need to make sure you have a discussion with your doctor if you're on any medications, to make sure they're safe in pregnancy. There's some medications that you may be on that may need to be stopped. Some you can stop immediately, some you have to wean off it. So you can have that discussion with your doctor, and together you can make the right decisions. So once you've done the pregnancy test, you found you're pregnant, the next step will be to register. So you go to your GP surgery, you let them know you're pregnant. In most places, you don't now have to see the GP. The midwife is who you registered with. So you get to see the midwife, who then tells you about the process of pregnancy, what you should expect, how many appointments you should be. And depending on whether you have medical conditions in the background or not, most of the time you're managed by the midwife. But if you have medical conditions like hypertension, diabetes, or any of those other conditions, or you've had a previous pregnancy that was turbulent, then you may have to be under the hospital, in which case the midwife would refer you to the hospital. Thereafter, the midwife would then give you the schedule. If it's your first pregnancy, usually you have about 10 appointments throughout. If you've had a baby before and there was no problem, then they could reduce it down to 7 appointments. Once you've had that, the midwife will arrange for you to have a scan done. It's what we call the dating scan, and that's usually done between 10 and 13 weeks. What that does is actually just to date the pregnancy, to give an accurate estimate of how far you are into the pregnancy. So once you've done that, you will also have some blood tests done at the start. Baseline blood tests, and that usually be arranged by the midwife.
And all of these are during the first trimester?
All I'm talking about is within the first trimester. So there's a lot of activity within the first trimester. And once you've gone past the first trimester, then you go into the second trimester. In the second trimester...
Before we go into the second trimester, sorry to cut you, Dr. K, is it at first trimester that, a lot of people feel, if there was going to be miscarriage, is it usually here that we stand the risk the more? And so another question to tie to that is, does sex make you at risk more than usual during the first trimester?
Okay, so thank you. Those are 2 questions. I'll answer the straightforward one first. Sex does not affect the pregnancy. So you can actually have sex throughout the pregnancy, except you are advised otherwise. The guidance out there says sex in pregnancy is permitted unless you have a specific reason why you can't, and you will have to discuss that with your GP. The other bit in there is about the miscarriage. So in the first trimester, which is in the first 13 weeks of pregnancy, if there's any abnormality with the baby, most of the time you will find that there will be you will have a miscarriage. So the miscarriage in the first 3 months of the pregnancy usually is not investigated unless you're having recurrent miscarriages, and that's because the body itself will most of the time get rid of any pregnancy with anomalies. And how does that show up? A lot of times it could show up with bleeding. Sometimes will start very light and then could get very heavy. The other things it could show up with is pain in the tummy. And I have said to you, if you have one-sided pain in the early phase of pregnancy with bleeding, you must get in touch with your doctor, because one of the important things is we need to make sure that you don't have an ectopic pregnancy, which is a pregnancy in the tube instead of inside the womb. So that's very important. So I hope I've answered those questions.
Yes, you have. Yes, you have. Thank you very much. So now let's move on to the second trimester.
So in the second trimester, which is from 13 to 26 weeks roundabout, it's usually a stable period, except you have medical conditions. What some people, and I'm going to say all through pregnancy, there's some things that you need to pay attention to. And it's just the basics, things like your diet. You need to make healthy choices. Yeah. It's very important. There's some things that are discouraged when you're pregnant, and things like unpasteurized milk, soft cheese. It is advised that you should avoid this, just because with it goes the risk of infection. So I'll talk about healthy diet. You need to go for a balanced diet. Eat a lot of whole grains, fiber, carbohydrates, fats, and protein in the right proportion. You also need to drink a lot of water. Hydration actually helps the body at all times. So the recommendation generally is, on the average, you need to take 2 to 3 liters a day, which is an equivalent of about 6 to 8 glasses of water in a day. What is also important during pregnancy, and this is throughout the pregnancy really, is exercise. But when we talk about exercise, you need to be careful. You need to do moderate exercise, no heavy exercise, because heavy exercise will affect the pregnancy. But you want to do at least the minimum, and the minimum is 30 minutes brisk walking for at least 5 days a week. Barest minimum, that's fine. The other thing which you need to pay attention to is your sleep pattern. Sleep hygiene is very important. People generally, the recommendation is that you have 6 to 8 hours of sleep in 24 hours. What that does is it helps your body rejuvenate. It revitalizes your body, so it's very important. The other thing which we need to talk about is if you're smoking, then it's not good for your health. Neither is it good for the baby's health. You need to stop smoking. If you're taking alcohol, the recommendation is if you can abstain from it, the better. And especially towards the end of pregnancy, because there's something called fetal alcohol syndrome that actually affects the baby. So we encourage you to avoid alcohol if you can. So during the mid trimester, which is the second trimester, there's not much of activities going on. And if you just follow good lifestyle advice, most of the time you should be fine. If you notice anything untoward, for first pregnancy, it takes a bit longer for you to begin to feel the fetus moving. So for first pregnancy, most people about 15, 16 weeks, you begin to feel the fetal movements. But for the people who have had children before, it comes on a bit earlier. And also because they can recognize it, they've been there before. So in the second trimester, you have things like you can feel the baby moving. If you have trouble with sickness, you see your GP, and that will be attended to. So that's the second trimester. Then you get to the third trimester, which is after 26 weeks. And at that phase, obviously in second trimester, you're already getting yourself ready, you're preparing if you're working, it's okay to go to work. If you're having trouble at work, you just ask for adaptations if needed. So in the third trimester, that's when you begin to prepare for baby. All through the pregnancy, you would have talked about what kind of delivery do you want. Some people opt for home birth. It's not for everyone. If you discuss with your midwife, they'll tell you whether it's available and it's appropriate for you or not. So in the third trimester, you're actively preparing for delivery. And part of the things you need to do in there is discuss your concerns with the midwife, and that will be addressed. And then you also need to discuss, how do I know when I go into labor? So these are the things. If it's your first pregnancy, these are things that you need to discuss. At any point during the pregnancy, if you're bleeding, you need to seek medical attention. If you're leaking, so in the third trimester, some people will have premature rupture of membranes. If you're leaking fluid or you have discharge, in pregnancy, there's a little bit increase of discharge, but it's not smelly, it's not itchy. It's just there. If you have itchy discharge or smelly discharge, then you have to see your healthcare professional for that to be dealt with. The other things is, for some people, they have pelvic pain. And that's just because as the baby moves down into the pelvis, sometimes you get pain, but you can discuss that with your healthcare professional, because there's physiotherapy available, and some people might need a gadget. If they have dysfunction of their pubic symphysis, they might need some equipment to help them with that. So that's basically a run through of the different phases of pregnancy. You will have blood tests done twice in the pregnancy, and a bit more if needed, depending on what your medical conditions are. So I think at the end of the day, it's working closely with your midwife. And as you do that, if you have any concerns, don't ignore it. Talk to your midwife. If you cannot get your midwife, talk to your GP, and your GP will guide you as to what the next steps are.
Yeah, thank you very much, Dr. K. And for sorry, I've got my pencil because I kept taking notes. And then for our viewers that are not in the UK, when Dr. K says GP, she's referring to your general practitioner. So your doctor, if, for instance, if you're in Nigeria, basically talk to your doctor. When you hear talk to your GP, she means talk to your doctor or your general practitioner or your gynecologist if you have access to one. Thank you very much, Dr. K. That's a quick run through of all the, the 3 trimesters in pregnancy. Now, as we were talking, I was jotting down, I remember you said to exercise. So I was going to ask what kind of exercises would you recommend, but you said that brisk walking at the barest minimum. And I know there are fitness coaches who help with exercise during pregnancy. And I know those exercises are really very helpful, particularly when you're drawing near to labor. They help you facilitate a quick one for your labor. Now, I want to ask a question about myself as a woman, or the woman who is pregnant and her spouse. How do pregnancies affect intimacy with couples? Intimacy now I'm talking about, earlier on you talked about sometimes the woman could get touchy and cranky and all of that, and then sometimes she's scared, oh, if I have sex, I can lose my baby. How do all of those things that happen during pregnancy affect our intimacies as couples?
So yeah, that's a very good question, because just as you alluded to, if not properly dealt with, it could lead to relationship problems. So I encourage both parties to have regular discussions. During pregnancy, there's a lot of hormonal changes, not just hormonal, but also physical changes in the woman. So it is important that there is an understanding. I have established the fact that sex during pregnancy has no adverse outcomes, except you have specific medical conditions. And if that is the case, your midwife will discuss that with you. But generally, you can have sex. I think it's all about understanding. and it's all about discussion between the two parties.
Yeah.
The woman may sometimes have times when she doesn't even understand her body. She doesn't know what's going on with her. Especially for the first pregnancy, you might feel a bit more tired. You might feel bloated. You might feel heavy. You might just feel out of sorts. And the important thing is to communicate. In relationships, communication is very important. And I think it's one, communication, two, understanding between the two parties. Because if a woman is feeling down and tired and she's just not in the mood, then the other party should be able to understand. But at the same time, the woman should bear in mind that the other party also has needs. So I think both parties should be understanding towards each other, and good communication would help. Part of the things that would also help is to use the right vitamins. So there are some vitamins that you need to use. So if you're of the Black, Asian, minority ethnic group, then and you don't have enough exposure to sunlight, then it is recommended that you have vitamin D. And that will be about 10 micrograms or 400 international units. If you're in the UK, there is a program called the Healthy Start Program, and you can have it free of charge. But if you're not entitled to that, or you're not in the UK, you can buy it off the counter. They're usually quite inexpensive. Also, the midwife at some point in time will do a blood test. Iron tablets are not routinely recommended in pregnancy, but if your blood test indicates that you're low in iron, the midwife will advise appropriately and make sure you get a prescription for that. I've talked about the folic acid, which ideally you just continue till about 13 weeks, and then you can stop it. So I think, and a few people may be on aspirin depending on their medical history. That's for those who have had recurrent miscarriages in the past. But all this you can discuss with your doctor, and you can reach an agreement concerning the medications. I mentioned the vitamins because those also help you. They boost your morale, and also just make sure you're a bit healthier. And if you're sleeping well, exercise, drink a lot of water, eat the right food, it will keep you going, because remember, you're eating for two. You're eating for yourself and you're eating for the baby.
So a lot of us use that excuse to eat too much.
I was going to talk about cravings. In pregnancy, also you have cravings. I remember when I was pregnant, I just wanted, people from Africa would know, from Nigeria in particular, know what you call mama pots. That's the rice by the roadside.
Amala roadside, that's for me too.
I never would eat it, but in pregnancy, it was like, when my husband's going to, I said, please, when you're coming back, just get me that. And there's room for that, but we always have to say for everything, it's in moderation. Make sure whatever you do it in moderation. So I think with understanding communication, there shouldn't be, pregnancy is a journey and it's a phase. So that it shouldn't lead to relational problems if you communicate appropriately.
Thank you very much.
And it's for 9 months, so you're not going to start for 9 months.
Forever.
so I think enjoy it. It's part of life, so please enjoy every bit of it.
Thank you. There's some things you said that I'm looking back now. Like I said, my first son is 19 years, going to be 19 in a couple of weeks' time, and I'm looking back and I'm remembering those cravings. Oh gosh. Mine was amala. It has to be amala, and from the roadside. And I have a particular one that I wanted. I always wanted that particular. And you know what, Dr. K, when they bring that amala, the only place I can sit to eat that amala is on the floor.
Whoa.
If I sit on the chair, I'll throw it. I don't know. I won't be satisfied. It has to be on the floor. And it's so amazing how pregnancy just switches you over. And like Dr. K said, is you having the conversation with your spouse. Some spouse will be like, what's wrong with them? I know, I read it somewhere in a woman's group that, what's this woman? The only thing that calms her down is smelling the underarm of her husband. So you always have to do like this way so that she can just put her nose there. And I'm like,
different strokes for different folks.
And so if that, I just think about that kind of man, I'm thinking that man must must try everything.
Understanding.
Very understanding. So it's having the conversation. If this is how I feel, being able to talk to the person. And there's something Dr. K said again. You said the woman should be considerate, but you should consider your spouse as well. Let your spouse know what you're going through, and that I think that goes, when you said that, I said, that's deep. That not only goes to our relationship when it comes to pregnancy, but in every area, even with my relationship with you, Dr. K. This is what I feel, this is how I feel, this is what I expect, communicating, so that if I expect Dr. K to check on me once a week and she doesn't, I won't be upset. It's because I haven't told you. But if I say, oh, Mama K, please always check on me once a week, or I'm your baby, that kind of a thing, that this is Kiki's expectation. Do you understand? And it goes a long way to help our relationship. I just thought I would pull that out, just talk about every area of our relationship.
The only other thing which I probably didn't mention, and it might just be important, is during pregnancy, there are a lot of changes in the woman's body, including her breast. So for most women, you have breast engorgement, you have breast tenderness, and the spouse needs to understand that. So you need to be mindful of that, because sometimes that would lead to a lot of issues. The woman might just be in pain, it's swollen, tender, and you just need to adapt and change through the phases of pregnancy. And as you do that as a couple, you find you have better relationships.
Thank you very much. Okay, thank you for pointing that out. And I think that also happens during ovulation, when you be like, no, don't touch me, don't touch that part of me. It's it could be very painful. I'm a woman, that I know very well. Thank you very much, Dr. K. So you answered a lot of my questions as you talk, but one question that I've got is, what specific things should we know to help, or should men know to help women during pregnancy? Now, I want you to focus on when you talk about the when they're being touchy and cranky. I want you to talk about when they are spotting. I want to talk about when during the discharge, because sometimes those discharge can be very irritating. So how can men, or what can they do to support the woman during pregnancy, from the first to the last of it, or trimester?
That's a good question. And I think I always go back to, first of all, communication, one. Two, education. So in some areas, in some countries, you actually have antenatal classes that the spouse can go with his partner. The husband and wife can go together for those classes. And I think the most important thing for me as a woman in pregnancy will be the support. The spouse has to be very supportive. And how can you be supportive? Recognize the fact that there are changes in your spouse. Go for the classes together if you can. Make every effort. It might mean you're taking time off work, but it's quite important, because knowledge is power. And when you go for those classes, what they do is they actually teach you about the changes. So you go through the changes. They also tell you what you can do to help. So you're not scratching your head and looking up in the air and not really understanding it. So you talk about communication, you talk about support. Then the other bit in there is the understanding, because even after communication, there has to be understanding. So if a woman is bleeding, obviously she's going to be bothered. She's going to be upset. So her response may not be the ideal one, because at that point in time, she's probably worried. And it will be good for the spouse to be understanding at that point in time, and to support her as she seeks treatment and answers to her questions. If it's things like discharge, the woman obviously will be advised to see her doctor or her healthcare professional, and you can have tests done. In pregnancy, one of the things that could happen is what we call thrush.
Yeah.
which is vaginal discharge. And classically, sometimes it's quite itchy. The woman, there's treatment for it, and sometimes the spouse also needs to be treated. Because if the woman alone is treated and you have sex later on, it can be transmitted, and then it's sort of like an on and off thing. So for the spouse, you need to be understanding that if the wife is receiving treatment and he says you use the screen, there's no need to fight over it, and there's no need for accusation of this. It's even babies get trash. Yeah.
Yeah.
So it's something that needs to be treated, and doing it together makes life easy for both of you. So I've talked about communication, I've talked about support, I've talked about understanding, I've talked about showing love. It's important, very important, because love covers a multitude of sins. Where there is love, everything goes, you know. So I think that is key. That is key. And at the end of the day, that's a baby for both of you. So you are in it together. The idea will be for both of you to go through that journey together. And at the end of it, you celebrate the delivery together.
Yeah, awesome. Thank you very much, Dr. K. Thank you. And you've said, do enjoy the moment, support, get educated. And one thing I wrote down when you were talking about the exercises is that the men can even exercise with a woman. She wants to go on that walk, make out time to go with her. Like you said, it's our baby. I know that there's some terms that a lot of us use that we say we are pregnant. So the fact that I'm carrying the baby doesn't mean I am the one that is pregnant. So both of us are pregnant. So we should treat it as such. So go on exercise with a wife. And then there's one that I used to love so much because my first son, it was so active in pregnancy. So whenever I'm touching it, I always feel excited when my husband is around to touch the baby as well. So, share in the excitement with your wife. It's very key. I think every woman will love it when you're excited about the baby that is coming and your spouse is sharing in that excitement as well. So yes, share in the excitement. What else have I got here? I think those are the two things I've got. Oh gosh, Dr. K, you're making me want to have one more now.
You're on your
After
own.
years, I'm on my own.
You're on your own. And I think also is the fact that we need to be mindful that the baby feels all those changes.
Okay.
So we need to be very mindful that the psychological well-being of a pregnant woman is very, very important.
Yeah.
And that's why the support is very important.
Wow. Thank you for putting that in, that the baby also feels all of those things that are happening around.
Stated, yeah.
Thank you. Thank you for mentioning that. Now, one question I've got is, what would you say to a woman in waiting, considering this is Mother's Day month, the month where we celebrate mothers and womanhood? What would you say to that woman who is currently waiting for conception?
Yeah. So for a woman who's waiting for conception, my advice will be to trust God. Do your best and leave the rest to God. There's something about faith and action. So you have faith in God because it's the fruit of the womb is a blessing from God.
Yeah.
It doesn't matter what faith you are. That's just standard. That is as a blessing from God. Yeah. So I said faith and action because you first of all have to trust God. Then the action bit is you then need to play your part. And what is the part that you need to play? If you're trusting God for the fruit of the womb, then like I said, start your folic acid. 2, make sure you have regular sexual intercourse with your husband, with your partner. It's interesting.
The partners will like that bit.
It is. At least 3 times a week, I say minimum. Wow. And the reason being, I have had couples who are trying to get pregnant, but they are loggerheads. At nighttime, they're sleeping in different rooms, and you're thinking, How is that going to happen?
Mm.
Also, the reason why I said trust in God is anxiety will mess up your hormonal system.
Mm-hmm.
So you have a lot of people who are in waiting, so worried about it. Well, I say to people, worry is not going to change anything.
Yeah, sure.
If at all, it's going to make you a bag of worms.
Mm.
So rather than worry, focus on something else. I'm a Christian and I'm a born again Christian. So what I will do is I get the word of God and I use it to counter my worry. Yeah. I take my request to God. I just talk to him about it. And then there's another scripture that says pulling down. It says casting down every imagination and everything that exalted itself against the knowledge of God. So those thoughts that make me worried, because I've seen a lot of people that are really anxious. And also at the same time, I've seen people who, when they let it go, suddenly get pregnant. Because when you worry, when you're full of anxiety, it affects your hormonal system.
Yeah, it does.
And that also then delays you getting pregnant. So go for checkup. The fact that you're Christian doesn't mean you shouldn't go for checkup. Go for medical checkup. What that will do, if you're a Christian, is it gives you your prayer points.
Yeah.
You know how to direct your prayers. You know what the problem is. Some things are treatable, some are not treatable. And when I say some things are treatable, people go for checkups and they can't find any reason why they're not getting pregnant. So for things like that, you just have to go back and pray and trust God. But for some people, they find a reason why they're not getting pregnant, and there's treatment for that. So where for those in waiting, I cannot overemphasize the need for cooperation between both parties. In the African tradition, it's sort of said that it's the woman's problem. But as a medical doctor, I know it's not always the woman's problem. The man has to work hand in hand with the woman. You need to do the investigations together.
Yeah.
So the man does his own investigation, which is looking at the semen, and the woman also does her investigations, which include blood tests. And very often, the woman is left to go on her own, and that is not ideal. Because as a GP, I wouldn't refer you without putting the hospital wouldn't deal with you without putting both pictures together. They need the sample from the man and they need the sample from the woman. And whatever the case may be, you can work it out together. But if you don't, then why would you want to bring a child into a dysfunctional relationship anyway? It wouldn't be in the child's best interest. So these are little things so for anyone that is in waiting, I say don't give up. I say continue to be hopeful, continue to pray, have faith in God, and do the needful.
Thank you very much. And I want to echo something you said, that a lot of us undermine or we don't pay attention to. Go for checkups. And that would also help you know what you want to pray about. A lot of us, particularly those of us that are Christians, we hide under the fact that everything is fine, it is well, and so we don't go for checkups. So you don't even know what you're praying about. So yes, I think I like that. Go check yourself. Even in other aspects of our health, go get yourself checked. And I'm sure it's good to know that it's good to have a born again Christian I'm sure there are a lot of you in the industry are born again Christians, but are medical doctors. And I'm sure God has given you the wisdom for a reason, for our benefit. So go get checked. Get understanding of what could be wrong, what is happening, and then you know how to tackle it on your knees. Thank you very much. You see now, Dr. K is full of wisdom. Thank you so very much, ma. In the last 1 minute that we have, there's a question I missed, and that is, all of those changes that happen in our bodies as women, how do they affect our lives after delivery? Is there any way they affect our lives after delivery?
So in the last few minutes, I'd like to talk on psychological well-being. So those changes, so there's something about preparation, and there's something about healthy lifestyle, which we've talked about.
Yeah.
But the psychological well-being is very important, because if that's not well looked after, so a woman who has gone through delivery is going to another phase again.
Yeah.
And it all depends on even how the delivery went. For some people, they need emergency cesarean. That's almost like a shock to the system. For some people, they actually have vaginal delivery, but then have cuts, they have tears, they have episiotomy, they have wounds down below. And then after delivery, then you have struggles with the baby's hair. I have to breastfeed. I'm struggling with latching on to breastfeeding. I'm not producing enough milk. I'm not sleeping well enough. So we talked about the importance of sleep. But sometimes even when you want to sleep, you can't sleep because the baby is up at night initially. And what these things may do is, if it's not well dealt with, the woman can go into postnatal depression. And this is where support is needed in the after delivery. The woman needs a lot of support with the care of the baby, with sleeping, with eating, whatever form of support that can be given is well appreciated. Because if you don't have a good support system in place, then we do have the risk of going into postnatal depression. And if you go into postnatal depression, then that's going to make it difficult to look after the baby. And a few people then have to go on medications, which if you can avoid by putting that support system in place, that's much better. I say, if you're feeling like you're going down under, you're struggling, and you're getting overwhelmed, shout for help. Shout for help. You must have some community, maybe your family members, it may be your church members. Then there's support agencies out there that can help you if you don't know what to do.
Thank you very much, Dr. K. Thank you. If you're struggling, shout for help, ask for help. Yeah, thank you very much. And I like that you touched on that postnatal depression. It's a lot of things a lot of us do not, it's something a lot of us do not know about, and it's good. So when you find out that there's something wrong, ask for help. And then for those of you around women that are having their babies, support them. And as Dr. K was talking, forgive me, I'm a mother-in-law to be, but I just want to say that for those of you that are mothers-in-law already, this is not the time to prove the point that you know better. This is not the time to want to teach and, correct and make life miserable for this woman. It is the time to support in the way that she needs it, not in the way that you want to give it. It's like you speaking your love language and thinking I would understand it. I would understand it. Speak my love language and I would support in the way that the woman needs to be supported. Thank you very much, Dr. K. God bless you so much for all of putting us through all of this. I have had a good time. Viewers, I'm sure you've had a very good time as well. Please, if you have Dr. K has said a lot. She's taught us a lot today. But if you have any questions or anything you want to add to this, feel free to add it to the comment area on this channel. And I'm sure Dr. K would be happy to pick them up. Even if she can't come back on, she'll be happy to, give some responses as chat, right, Doctor?
Yeah, I think anyone that has questions, if you look on my screen, you can see Healing G Zone.
Yeah,
exactly. That's my Instagram handle. So if you message me, DM me, direct message me at Healing G Zone on Instagram, I'll pick up your message and I will respond to you. I say give me a minimum of 48 hours because I'm still a practicing GP. I'm trying to juggle things together. But yes, please ask. If you go on my page, you'll find Ask Dr. K. Whatever the question is, ask Dr. K. My passion is to educate so that people can make right decisions and choices and live a wholesome and a fulfilled life. My motto is live your best life.
Live your best life. Yeah, thank you very much. I like that motto. Live your best life. And I say to my children, life is beautiful and I've got to live it. So life is beautiful. You've got to live the best of it. We've got to enjoy. And we're children of God. So if you're a Christian, That's a inheritance. So why shortchange yourself and not live your best life? Thank you so much, Dr. K. Thank you, our viewers. Thank you, everyone, once again for joining us on A Date with Kiki. Remember, if you haven't subscribed to this channel, this is the time you want to do so. You've seen that we bring in very interesting and educative, stuff on A Date with Kiki. I'll see you again next time with another educative and interesting topic around manhood, boys, women, and all of us alike. I love you, and I'll see you again. Bye-bye.
Thank you.
Oh, thank you very much, Dr. K. Thank you.